I want to take time to thank every last one of you guys for what you guys do out in this community. Recently, we had one of our own, lose a lot in a traumatic event, and just to see the rallying around that family just shows the type of community that we've built over the last year. We do a lot of great things. I mean, I always sit and put it, we are the new Motown, meaning we got a bunch of great talent, but we're nobody without each other. And I can't do this without you guys. And I hope over the last year being with us, you guys realize that this is the think tank and you guys can't do a lot of things without us. We're all amazing at what we do. And as Shelly said, this is the last time that we all gonna be together this year as a group, but it's been a rough year. We've had a lot of dividing. We had deaths all around the country, hurt all around the world. But, we managed to all stick and come together and represent Pierce County and really become that blueprint of what community engagement truly looks like. A lot of people really ask because they don't know what community engagement is, but looking at all these screens, this is exactly what it is. It's taking out every one of our organizations and bringing in the personal value of each other, leaning on each other, holding each other accountable, and honestly having the leverages from our organization. I'm very thankful for my leadership at Workforce Central, my team at Workforce Central, always working in the background to support the work that we are doing. It's amazing. It's an amazing feeling. And, I'm thankful for that. I'm going to go over a couple wins that we've had this year as a group. And it's been amazing as a group. The Pierce County Community Engagement Task Force as a whole, whether you've been able to be at meetings, not be at meetings, support us, whatever it is, this is you guys' home. And your home, your front, we put out $300,000 of goods back into the community this year through donations, through planned time, through events. We did that as a unit. I thank the ones that took time to plan and didn't think selfishly, but said, you know what, this is about this team and we're going to do it as a team. I want to thank the volunteers that came out to all those events and held us down when all of us could not be there. We did that as a team. We served 650 families in Pierce County unselfishly, but said, this is coming from us. We want to support you guys in any way that we can. We did that. We added 50 organizations to the task force this year. 50. Actually 64. I didn't want to be bragging, but 64. We had 50 at the end of last year. We have 114 organizations that know the task force, that are down for the task force, that represent us and support what we do. Whether you're a contact, a connect, or committed, you are here with us and we represent you guys and you guys represent us to the fullest. Thank you guys so much for that. We added over 70 new members to the task force in the last year. And that's because we talk about it. We brag about who we are as a team and we bring everyone together. They talk to us about this. One of the other big wins that we're going to take away this year is the state of Washington called me 2 weeks ago and said, I heard to go through Pierce County, we got to go through the task force. And I said, yeah, pretty much. So in the coming year, Washington State is reaching out to our leadership in the task force to assist them in their 10-year plan for equity and disparity. So we've done big wins. We may not talk about them all the time, but damn it, we did some wins this year. We're going to go solid. We're going to continue to have those wins and do some amazing things. A lot is changing in our group. A lot of structure is coming in this group. We want bigger wins. We raised the bar over the year, but we're about to change the standard next year. This year was all about community engagement. It's all about us coming together. It was about us building this universe that we have, that we call a community, so that we can serve our community the way it deserves to be served. A lot of things are going to change with a lot of different laws, a lot of money being swapped around. 2021, y'all, it's the year of resiliency. And I hope every last one of you guys are ready for that, because it's going to be big. And we're going to hold down this community. We're going to support each other. And we're going to get the big wins. So that way the nation knows that Pierce County rocks. And it just because they didn't see us on Cops, okay? We done did big things. And anybody from the 90s knows what I'm talking about. They don't see us on TV on good things that we did, man. So please, again, thank you all so much for being here, for your efforts, for uniting this group together. I'm so blessed to be able to call every last one of you guys my friends. As you guys know, I don't like organizational relationships. I like friendships. So you guys have all become my friend over the last year. Please continue to reach out to each other when you guys need each other. Let's continue to change the world, change the way that people think. We can't rebuild a lot, but we can start rebuilding a lot of these hearts in this community. With that being said, man, let's get ready to rock and roll and have an amazing event.
All right, I guess, Jeff, we're gonna transition. So right now, what we're doing is I just asked everybody, share your contact information in the chat, introduce yourselves in the chat. Thank you so much for showing so much love, and we appreciate you. So how about another round of applause? I mean, I don't know about y'all, but that update that Tamar just gave, I mean, I need some hoops, some hollers. I'm going through these pages. I mean, if you could, I just want to do a quick little diversion real quick. If you could, I don't know if we have the ability, I think we can, if you could put a GIF in the chat about how that makes you feel about the work that we've done, you know, be real creative about a GIF, 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 that you, if you could describe it any other way, a GIF or an emoji, that should make you feel just overwhelmed and amazing. I just think that it's just, that just was some great news. So thank you so much. And I just want to say, Tamar Jackson, this was meant for you to do. This was designed for you to do. So I definitely appreciate your leadership and guidance in this way. One thing, to be a good leader, you have to also be a good follower. Followership is important. So you have to know where that moment happens and how to do that very well. So I think that is great. So we're going to move on and transition. So Jeff, we have our first guest speaker. So I'll turn it over to you to introduce.
For sure, thank you. So our first guest speaker is Mr. Daniel Wirth with the American Red Cross. And sir, I'll let you take it from there.
Thanks, Jeff, and thanks, Shelley, for the opportunity to speak here. Thank you, Tamar, as well. I'm just excited to be here and be part of the task force and have a few minutes of your time this morning. So my name is Dan Wirth. I'm the executive director for the South Puget Sound and Olympics chapter of the American Red Cross. I'm here today to give you an overview of the Red Cross and our services and provide some potential opportunities for collaboration and joint impact within Pierce County and the South Sound. I've been with the American Red Cross for a little over 6.5 years and just started this role in January. Next slide, please. I had the good fortune of meeting with, this is the mission of our organization. It kind of drives our work throughout the country. I had the good fortune of meeting with Jeff and Tamar a few weeks ago and was just really drawn into the opportunities I think that the task force presents. And I really appreciate Tamar's approach for friendship. I told him that while we share different loves for different football teams, that I would go ahead and caddy for him anytime that he's out on the golf course, and would love to have that opportunity to see him play. Next slide, please. So these are our main areas of focus of work. We're standardized across the country in the opportunities that we provide. So I'll dive into each one of these a little more deeply. And Jeff and Tamar, please do keep, or Shelley, whoever, keep me honest here on my time. So it's made clear to me that in order to present, that I had to give an ask. You know, what can you do? So I've tried to tie an ask into each one of these areas. So there's opportunities for collaboration, and depending on what motivates you and your organization, one thing might speak to you. more than another. Several things might speak to you, nothing might speak to you. So we'll see what fits. Next slide. So our disaster cycle services is probably one of the most common areas where people hear about the American Red Cross. So next slide. Nationally, we respond to over 65,000 disaster responses every year. Our focus is on the critical first 72 hours following a disaster. We cover basic needs such as shelter, food, clothing, medications, mental health support in that 72-hour time period. The most common response activities are single-family or multifamily home fires. And here in the South Sound and in Pierce County, we see some flooding, storm damage, and wildfires. As many, some folks on this call may have experienced this summer, fall, with the wildfires that we had just down in Sumner. In fiscal year 20, our fiscal year goes June to July. We responded to 1,000 disasters throughout our region and 802 home fires. Here in the Pierce County area is about 125 home fires that we responded to. Next slide. So with the focus on home fires, we are about 6 years ago, next slide, we made a national commitment to get ahead of home fires and to try to save lives. Nationwide, the program has documented more than 700 lives saved due to the actions of our partners, volunteers, and the community members. Which means either the smoke alarm that we installed for free into people's homes, or the education that we provided one-on-one in people's homes aided their escape from a home fire. And they were able to get out of that fire and live to be with their family for another day. We recently documented 3 lives saved in Grace Harbor County due to this program. The smoke alarms that our partner, the fire department out there, installed, and the fire education that was provided was able to save a family of 3. So in addition to installing smoke alarms, we also conduct a youth education program. We have a remote adaptation at present, so hope you're listening. There might be an opportunity for collaboration here. This is the Pillowcase Project. It's a 40 to 60 minute fire safety and local hazard preparedness presentation that's geared towards 3rd to 5th graders. We also have a number of additional free preparedness programs, such as Ready Rating and Be Red Cross Ready. The Ready Rating is a free web-based and self-paced emergency preparedness program that helps organizations of all types prepare for and respond to and recover from disasters. So you'll take an online assessment that gauges your level of preparedness, and then will generate automatically some next steps for you and provide action items. We also have a Be Red Cross Ready program, which is kind of our adult version of the Pillowcase Project, where we can provide a free education opportunity for adults, and we talk about preparedness and some common emergencies and how to prepare for those. So, next slide, please. Biomedical services is our probably another area that many people may have heard of the American Red Cross. When you think of Red Cross, you maybe think of blood and blood donations. So next slide, please. Across the country, we provide about 40% of the nation's blood supply. That's like 2.7 million blood and platelet donors. It processed into about 6.5 million blood products. and we meet patient needs in about 2,500 hospitals across the country. Here in the Northwest, we supply to about 60 hospitals in the Northwest region. In fiscal year 20, we collected almost 30,000 units of blood. 641 of those units came from Pierce County. We would love the opportunity to partner with you and your agency to host a blood drive, if that's something that you're interested in. We have some specific opportunities that the organization that we're hoping to target. One is sickle cell, and triple our sickle cell blood donors within the next 3 years. So typically members of the BIPOC community hold that sickle cell trait or traits that that are indicated to be compatible with treating sickle cell. So some of the general requirements for hosting a blood drive include use of an indoor space, approximately 1,500 square feet, with electricity and running water. Something like a large multi-purpose room or a gymnasium. And added bonus, if you're willing to host a blood drive more than one time a year. Quarterly, 3 or 4 times a year is ideal. You can also promote blood drives internally and just have it for your organization only. We do request that we garner about 40 to 45 registered participants for that blood drive. You can also open it up to the public. Or do some sort of hybrid, allow a time frame for your organization to register up to a certain date and then open it to the public following that. With COVID, we've instituted a number of safety measures, including mask requirements, social distancing, and screening of health screening upon entry to the building. So there are safety measures involved. If you don't, or your organization doesn't want to take those steps, you can also go to redcrossblood.org and register to donate blood. So next slide, please. Service to the Armed Forces is probably one of our least known about opportunities and services. So if you could go ahead, next slide. We have a 24/7 emergency care network that is available to active duty and retired and military veterans. It's a call center that's available to provide services, emergency messages for active duty military members. We're the only authorized communicator with the military that can send messages to active duty deployed military members to let them know that there is tragedy, perhaps a death in the family, and we notify their CO, their commanding officers, validate that message and that death, and then the COs can make a determination whether or not to allow the service member to come back for the funeral. They do that for births, deaths, or other significant life events. We also support Madigan here locally. One cool thing that we've done is in the COVID environment is our Service to the Armed Forces team has created a virtual healing arts program where the art supplies are delivered in a contactless manner, and the courses are conducted remotely via Zoom. So, next slide. Life-saving skills, first aid, CPR. Next slide. Our training services team educates about 5 million people across the country, about 75,000 in the region, and there are multiple courses a week, CPR, first aid classes. There's another opportunity for potential collaboration. You could contract with us. We could train members of your organization for a fee to become certified trainers to then teach first aid and CPR with your organization. You can sign up for a class at redcross.org. or we could also provide trainers for a fee to train at your organization. You never know when those life-saving skills will come in handy. We've had a number of lives saved in the local area due to people that had first aid, CPR training, and saw somebody collapse at a T-Mobile store here in Pierce County, and the team responded, provided life-saving skills until the help arrived. So they were able to sustain a life. Pretty cool stuff. Next slide, please. And then finally, international services would be the last one. I'll hit this one pretty quick as well. Next slide. We do provide support to our sister agencies throughout the world with disaster assistance, and which enabled more than 20,000 families. We also, we also have a reconnection opportunity, or there's for the word is escaping me for the moment, but it's emergency messages that we can send between family members that are overseas. Not amazingly enough, not everybody has Facebook, Twitter, or email, cell phones. So sometimes family members get separated from one another and need to send emergency communications and be reconnected. So we have a network that we can utilize and activate to send messages back and forth and reconnect families. Next slide. And then the most impactful here, I'll talk a bit more about the local impact. Next slide. We have 235 chapters, six divisions, 50 regions, and 235 chapters across the country. And we're powered by volunteers, 300,000 volunteers across the country. Next slide. Here is our area. You can see the 8-county South Puget Sound and Olympics chapter there on the upper left. Yep. Next slide. So this is some of the local impact. These are based on 2 to 3 year averages and I mentioned some of these opportunities or these. I mentioned some of these in the services that we provide a little bit earlier. So the 6,000 military members is just absolutely incredible, and that's really due to the JBLM being here, Madigan, and a large number of active duty veterans, as well as retired veterans that stay in the community. We have a very significant impact in the military community. So finally, next slide. We are a volunteer-led organization. 90% of our workforce is volunteer. So I'll just recap real quick some of the collaboration opportunities. Volunteer, sign up to be a volunteer at redcross.org. If you do that and you're, please let me know. Reach out to me. I'd like to follow your application through and just steward you and ensure that, that you have a positive experience. Host a blood drive. If you or your organization is interested in doing that, we would love to have that opportunity. Engage with us in life-saving training, first aid safety or CPR training, or collaborate with us on the home fire campaign. Perhaps you know someone that needs some home fire safety education, or you yourself would like to engage in that opportunity. So yeah, would love to collaborate and look forward to what this presentation, this opportunity brings. So thank you again, Tamar. Thank you, Shelley. Thank you, Jeff, for the opportunity to present with you guys and be with you all today.
Thank you, Daniel. I appreciate that. Are there any questions? I don't want to transition to our next speaker. We do have a little time. If you have questions and you would like to ask one of Daniel, raise your hand or raise your hand in the chat, or just unmute and ask a question.
Daniel, I just want to give you a shout out ×3. First, I work at Franklin Pierce High School, and we do have a mobile Red Cross unit that comes to do blood once a year, but I will definitely put that in my principal's ear to do that once a quarter. We're gonna have to do it once a semester, so twice a year, just because of time, but after COVID, of course. So, but I will plug in there. The second thing is, I actually worked in social services for many years, and I have used your services for a couple of my families who had fires and lost everything. And you guys are incredible. Just the way that you interact with the families and communicate with them and let them keep their sense of dignity, I just applaud you. I am a Red Cross supporter 100%. Last thing, I did a training. I was a child and family advocate at the University of Washington, and I did a training for Red Cross. 3 weeks later, I was at a community event, and a woman dropped dead in front of me in the restroom. And I literally did CPR. I broke 2 ribs. She hates me still for that. I broke 2 ribs, but I was able to do CPR for 15 minutes. I was super exhausted. They came in, they were able to jump her heart, get everything going. I still communicate with that lady, and I always tell her, if I did not go to that training 3 weeks ahead of time, I would have just froze and just started praying instead of praying and acting. So I just want to tell you, Daniel, I am definitely a supporter of Red Cross, and everything you guys do, I applaud you and thank you.
Awesome, Benita. Thank you so much. And thank you for sharing your story. That's just absolutely incredible. If it's okay, I would like to connect with you and hear more about that story.
Sure.
Wow, isn't that amazing? We had such,
Awesome.
That's an amazing testimony. So I don't know about anybody else. If you have any other comments, or you want to connect with Daniel after this, please feel free to do so. We're going to go ahead and transition to our next guest speaker, Jeff.
Thank you. Thank you. We are super excited to have Norinda on, and we have been talking for many months about how 2-on-1 and the task force can partner. And so she is going to give us a quick overview and talk about that a little bit more. Norinda?
I'm going to try. Those of you who've already met me know me. I'm a Philly girl, and I can talk. So telling me I've only got 15 minutes and 2 slides, you are trying me. But I'm going to do my
Norinda, girl, just talk. Just talk to the people. Just talk.
I'm going to do my best. All right. So I wanted to start out. Let's get it right out there. 211 is a resource and referral hotline. And for us, based on the feedback we've received, we know that it's been a critical component in our overall impact, particularly in the last several months. But before I get into some highlights of the work that we've done, I wanted to start by asking everyone on the call, and you, Jeff, maybe can give me some guidelines on how you like to do this, if you like to popcorn it or what have you, but really wanted to ask the group, what do you think you know about 211? And I had to say think and italicize it because clearly I'm going to get into what 211 is, but I want to kind of flesh out what are some of the thoughts that are out there, or I won't say myths, but maybe what are some of the thoughts about 211 that are out there currently? Anyone want to share?
Yeah, if everyone can share it in the chat and maybe do it that way.
That's fine. Anyone has a burning comment I made, far be it from me to say they can't, but this is your show, Jeff, so you tell them. All right. So I'm going to just read aloud some of them. How's that? Makes referrals to many resources, is a resource tool, referral service to service providers for community members, resourceful, used as our system's common referral system, self-referrals, services for unhoused neighbors, support system, and a connection to a person. Oh, I love that. Marcy Boulay is my new friend. Okay. Single access point for special needs transportation in Pierce County. Recorded messenger referral system. Not sure how timely that is. Fair. Thank you. It only works if you call from a 253 area code. I like that one. Okay, it's a resource number for folks to get connected to assistance. Great resource for assistance, personalized. I wasn't going to talk about this prior, but Lori, I'm going to get it out right now since you asked. It's something kind of interesting about what happens when you call from a phone that has that local area code versus an out of town area code. And what I found in my work, I'll give you just a little bit of information about me. I came from another United Way in Florida, where I worked for 5.5 years as their director of community impact. And I led the division there too. And this came up a lot. What we learned through some of our research was that it often depended on the cell phone carrier. And we were able to work some things out for folks once we started troubleshooting. That's one of the things we do when we hear that there are challenges in getting connected. We try to troubleshoot, and we were able to make some headway with AT&T, as a matter of fact, because it turned out that calls were actually being redirected based on the area the person was calling from. So we don't have a whole lot of there's not a tremendous amount of consistency there, but that's one of the areas that I can get more information about what that's looking like in this community and get back to you. I will tell you, I still have a 352 area code from Florida. And when I call from that area, if I'm local in Tacoma, they know that I'm calling from Tacoma. I've tested that. But again, I will admit, there doesn't seem to be any clear consistency across the board. So we can get into that a little bit more. I'll look into that and get back to you guys. Here we go. What else? Dr. Bob says, we connect individuals and families with programs and services, help them navigate barriers, preventing them from becoming self-sufficient. Instead of multiple calls, the free helpline connects people in need with trained specialists to get matched with the right services. Yep, we call them navigators. Awesome. South Sound 201 provides access to hundreds of services and programs from Pierce, Thurston, and Lewis County. He's trying to get some United Way swag sent to him. Hold on. South Sound 201 is your free connection to basic needs, as well as a number of other community resources. It's a free service connecting people to critical programs. He's doing my presentation for me, y'all. This is too much. Utilities, rent, low-cost housing, transportation, et cetera, et cetera. He even mentions family-wise. You got to stop. Holiday assistance. Man, okay. This is fantastic. So, whoo. Here we go. We absolutely have time to go deeper in the Q&A today, and I'll just put it out there. Penny Belcher is the expert. She absolutely is the expert in this. And what I love is not only is she a treasure to us, at our United Way, but Penny's name comes up at the state level, and she's always being asked for when it comes time to talk to legislators or to just explain what we do and how we do it, because she's got a very long lens with this work in this region. So some have said she's actually a pioneer in this work because she did some of this well before she came to our United Way. And Jeff, you might have to give me a time check again. I go on a little too long, but I'm going to try to get to the meat of this. And you'll see that I did start out with a comment that Penny made to me, and I loved it. Don't know how original it is, but it resonated with me, and that's what I put here. What we were is not who we are, and who we are is not where we're going. And that is to say that we are all about growth, and we are, contrary to what you may have heard, we care about what the community thinks. We don't do this without the community. We do it with community. We know we have opportunities to do it better. As we do this work, sometimes, particularly with 211, they are very service oriented, and their work, I used to be a teacher, and so I often say they work from bell to bell. And that means as soon as they walk in to the minute they leave, they do a lot. So it's not an excuse, but it's a very, it's as efficient as it can be in terms of staffing. And one of the areas we know we have opportunity is outreach and direct engagement in terms of proselytizing what we do and ensuring that folks know how to access it and utilize it, particularly providers. So I'll just say ahead of time, we are extremely grateful for this opportunity. So thank you for having us. I think we can go ahead and go to the next slide. Okay, so if you think this is jumbled, blame Jeff. He told me 2 slides. This is it. Okay, so not the best layout, but let me address some things. We did hear some folks say that 211 is a pay-to-play system. However, 211 is actually an open system. It is absolutely free to both callers and service providers. There are, however, different levels of participation that are available because we know that not everyone needs or wants the same access to the system. So for service providers who value the opportunity and have the opportunity to provide care coordination for clients that includes tracking client outcomes, we invite them to participate in our closed loop referral system. And yes, we do pass on some of the cost to utilize the system with other members of the network. And United Way pays into that as well. And this year, as a result of some changes that were made in that contract, United Way increased their contribution to ensure that it was less of a burden for the other participating providers. So far, let me see. Here we go. South Sound 211, like Dr. Bob says, it serves Pierce, Lewis, and Thurston counties. We are back to normal hours of Monday through Friday, 9 to 4. In my dreams, we're going to expand 211 to be a 24/7 deal. You'll hear more about that as we start seeing making some gains in that regard, but that's the vision. So that way in the future, you can text, you can chat, you can do all these things, because as was previously highlighted, you actually get a human being that answers the phone. And what's wonderful with that is because our specialists are highly trained, whether you get a specialist or you get a navigator, I think we have a housing navigator, a behavioral health navigator, and a transportation navigator. Some of you may know better, so if I missed something, let me know. They have the opportunity to ask some questions, right? Not trying to be too intrusive, but the idea is if they ask some more questions, they have the potential to identify other areas of need besides what the caller maybe initially was focused on or intended, and they can receive multiple referrals if it's necessary. And again, if it's in any one of those areas where we have navigators, now you're talking about them getting into that closed that closed loop system. So, the other one, thank you, Corey. It's the Workforce Navigator. Duh, it's the Workforce Navigator, the one I should remember, right? Because of who I'm talking to. So last year we had over 35,000 contacts and there were 55,000 web searches. The web search that we are currently using is actually part of the network. So there are 7 different call centers in that network. And yes, we know there is opportunity there. That site is not fully built out. And it's a little bit of a challenge on our end because we're not actually in total control of that. But that is something that we are having ongoing conversations with Washington State 211 to flesh out what that plan is going to be. So that way it is a little bit more engaging. Right now it's pretty dry. You can get the resources, but it's just not, it's not as intuitive maybe, or it's not as user-friendly. We like it to be much better. So again, we're just keeping it real there. So from March to July, we had 25,000 total calls, and 4,000 of those we handled as part of that statewide 1-800-COVID hotline that some of you may have heard about. As you can imagine, the top 211 requests included housing, shelter, rent, and utilities. That wasn't much different from how it usually is, but this time, of course, it also included COVID-19 related questions. Top COVID specific calls included requests for testing, questions about exposure and business or gathering restrictions, questions about face masks, how to get them, etc. And we were able to get people connected to face masks because we were also doing that coordinating with our donor engagement and volunteer engagement work. And of course, there were also questions about travel. In order to meet the needs of the community, we had to expand our hours as well and add more 211 staff, which we did. However, some of the really exciting things that came out of this time were, and it's really attributed to the relationships that we'd already built in the community, and the strength, as Tamara was saying, how fantastic this group is, and it is, because it's representative of some of the most outstanding nonprofits and service providers in any community. And so during this time, we implemented a diaper bank. And from May until, and this was until July, we're going to have updates from this last quarter. 398 families have been given diapers and wipes, and over 18,000 diapers were given out. What's exciting about it is that now a 211 Family Resource Navigator can provide real-time information on diaper inventory and sizes available at each site. So I remember back in the day when I was a single mom and I needed help and I didn't have a car. Nothing more frustrating than doing all the things I needed to do to get to a location for a service and find out that they didn't have what I needed. So this may seem like a little thing, but it's a big thing. And I don't know if anybody on this call knows, but it's grounded in research. There is a connection between a need for diapers and child abuse. And so while this is not why we got into the game, we do know that making sure that families can get diapers when they need it helps to ameliorate some of that stress that families experience, and obviously take some of that financial pressure off, because you do know food stamps don't cover diapers and cash assistance doesn't go that far. So if you're in that boat, that's an added stress. Okay, so we're really proud of that. Let me see, that I lose my way. Here we go. We're also extremely proud to share that 211 became the single point of entry for behavioral health in Pierce County. So now in Pierce County, residents who need behavioral health support, which includes drug assistance programs and mental health providers, all you have to do is dial 211 to access a referral network. You actually don't necessarily have to go to your health insurance, because what we found is on average, it takes people about 7 calls to actually secure the help that they're looking for. So coordinated entry for behavioral health has been unprecedented in our network. United Way Worldwide found out about the work that we were doing and asked us to participate in a case study that highlighted the steps that we took to get there. And I was just tickled to death to be a part of that, and followed up with them recently to get some more information about how that stands in the network as compared to other United Ways. It doesn't mean that nobody is doing it, but United Way Worldwide is not aware of any other United Way that's doing it. So we're really, really proud of that. Also, Ride United, not sure if anyone's familiar with that program. We already had it before COVID, but during COVID, we were able to expand it again, based on the need. And so, and that's done with Lyft. So we were able to provide 461 rides, serving about 70 some, almost 80 clients. The service area includes 15 cities within Pierce County, well, 11 cities in Pierce County and 4 cities in Thurston. Qualifying trips include, and this is a lot, but I want you to hear this because it's not an exhaustive list. It includes medical appointments, ER trips, VA appointments, substance abuse detox, picking up prescriptions, job interviews, job fairs, completing pre-employment steps like fingerprinting, food access, including food banks, SNAP applications, grocery shopping. Keep in mind, we do know that there are limitations to this face-to-face access during COVID, but still, where these opportunities are available face-to-face or people need to get there, it's available to them. Meal sites, applying for public benefits or social services, access to housing benefits, shelter, tax prep, education services like getting enrolled in programs, being able to go to a parent guardian meeting at your child's school. So school engagement, financial coaching, and education classes for adults. The list goes on and on. So if you're not aware of that, or you know people who are looking to get assistance with transportation for healthcare, food, finance, education, or employment, please encourage them to call our 211. I probably now have gone pretty quickly, because even though I talk a lot, I talk fast because I'm from up north, right? But we do want to say that as part of our ongoing research, our ongoing outreach, we strive to ensure that all human service organizations serving in Pierce, Lewis, and Thurston are updating their profiles in our database to ensure that the community does get the most current information. So we would appreciate any help you can provide us by getting us connected to those organizations that are either new or not yet represented, or who maybe have had changes in staff and you're pretty sure that they haven't gotten around to it. We try to make that really easy. We have a database manager. Her name is Sarah Teague. She is available via email and or phone. They've been very gracious and have allowed providers to go ahead and just give some, simple updates verbally over the phone, and that's worked out really well. So that's one of those areas that we know that we could do better, and we're looking forward to participating ongoing with these meetings to ensure that we have a touch point to keep that conversation and that opportunity top of mind. But the other thing is, we are always open to ongoing feedback from the community. It doesn't happen to me very much now, but I will tell you at the United Way in Gainesville, I was that person who got every single complaint, every single concern, every single suggestion for 211, and we handle each one of those individually. We don't shoo or poo them. We require that. We need that because we, as Penny said, where we are is not where we're going. Our goal is to ensure that what we're providing is what the community needs, and that our investment in this work is efficient. So if there are any questions or comments about anything that I shared right now, you guys are free to ask. I don't know how much time we have left.
We have time for maybe 1 or 2 questions, and then we'll transition to the group updates. If there are any questions, I'm looking in the chat. Please raise your hand, and I'll call on you so I can see if your hand is raised. And if not, hearing none, seeing none. First of all, let me just say that was an amazing presentation. Fast talk or not, Norinda, you gave a lot of great information, and people are saying thank you for the work that you do. And so if you see the chat is on fire with a lot of positive confirmation and affirmation around the work that in the role that United Way plays. But also what I hope happened is for those of you who did not know about the 211 system and our United Way part, and United Way is a partner in the system and community and the role it plays that you now know. I know for us specifically in the workforce system, our partners who are our MOU partners who are part of that, they use the 211 system as a referral system. The great thing is you can track everything. You can see where a person was referred from, what assistance they received. So, we're always looking for these all-in-one systems and things like that. And we have it right here in our own backyard. And then I also want to reiterate, everything costs. So, everything costs. So I would never want you to, it's almost like giving away something for free, but it's not, it's less about the fact that it costs, but in order to keep it at the level that it is, and in order for it to function, yes, everything costs. And so, don't make cost your reasoning for not being being able to invest in something that actually does work and provides a great service to our community. And when you feel disconnected from the system because you're not in it, you kind of have to sit back and reevaluate where you want to invest and how you believe you can actually be a part of it. And in that way, we can get more partners, more community partners. And I'm sure there's a whole other plethora of ways to do that, but you've got the point of contact right here with Norinda, and she's giving you Penny's information as well. So I'm sure there's ways to be a part of the system to where it can definitely have more of our community-based organizations, grassroots organizations, and faith-based organizations a part of it to provide so many services. And it's about breaking away from what we look at as traditional service organizations. We want to tap into the non-traditional service organizations. And I think that's important when you're doing systems work to keep that in mind, that it's not about what we traditionally are used to seeing. It's about breaking the mold and looking in those non-traditional spaces where they're also doing great work and service. They're just not by design government or quasi-government funded type organizations, but they are doing a great deal of work in our communities. And so this is the work that we do. And this is why the task force exists, so that we can bring all of those elements together as well to, educate and inform. So thank you so much, Norinda. I appreciate you, sis. And
thank you, Shelley. Everything you said was just right on time. And so we do encourage folks who have an interest, but maybe are not sure what level of engagement they want with 211, or maybe you really see it as fundamental to the work you do, but maybe it's a financial challenge right now. Don't be afraid to talk to us. I mean, it would not be the first time that a group had to consider how might we be more inclusive to a nonprofit or an organization that needs this service, but maybe can't pay the exact same cost share as everyone else. So I know that kind of gets into a different territory, but never let the barriers, I say it, I'd be still on George Street in Philly if I let the barriers get in my way. So don't let that be something that stops us from having a conversation. And Tim is laughing. That's okay, Tim. That's all right.
But that's what I'm talking about. We have to think differently. The same way that we tell our participants, the people that we are doing this great work to serve, to get to a better place, to remove the barriers, we also, as the deliverers of these services and work, we have to remove our own barriers of thinking in order to be able to tap in and be in the vein and be of service and to be able to do more. So I'm gonna just leave that right there for you, drop that mic, and we're gonna move on to our subgroup update, starting with the organizational structures group. I will turn it over.
Shelly, real quick before we move on, this is Kelly. I had a really quick thing for Norinda, because my favorite day of the year is coming up, and that is the United Way Advocacy Day.
Yes.
While we had the whole group on, I thought, Norinda, is there a date set or any plan for Advocacy Day up on the Hill?
So, as you might expect, this is where Kelly and I first met. So, of course, she sees me, she gets all sentimental. But we don't have an exact day, but should soon. And essentially what we're hearing is, as you might expect, it's because it's going to be virtual, it's going to be totally different. So if you want to be a part of it, you just need to holler. And Kelly, I was going to follow up with you. So I don't know if this group wants to be involved in some of those updates. I can certainly send that to Jeff and you guys can figure that out, or we can figure it out together. But we are working on scheduling those conversations now. And basically what it looks like is probably shorter, obviously spread out over some time and not focused on one day per se, right? But we are going to be having some shorter, more specific conversations with these legislators. So if you got any friends on the Hill that, you can get us an appointment of our preference, that kind of thing, don't hold back. But I will definitely keep you in the loop as we know more about what that's going to look like.
All right. Okay.
Good? All right.
That's what I'm talking about.
All right.
And Tim is Tim is still present and smiling. So let's
love it.
Let's keep it moving. Okay, organizational structures group, you are up.
Hello. Good morning, everyone. From the organizational structures group, we are putting together a 4-part series. And we are calling it the Lens of Equity, focusing on the 4 Ps of your organization to ensure diversity, equity, inclusion, and accessibility are at the forefront of your organization. So the 4 Ps are policy, practice, people, and promotion. What we'll be doing is doing a deeper dive into policy. So what are the policies that your organizations have? What potentially needs to be rewritten to create a little more inclusion while focusing on the reach of diversity. Practices, what is your organization doing to ensure written policies are taking place? So the written policies that you looked at, the practices would be, what are you doing to not just check the box, right? And then people, being the heart of an organization, what are you doing to connect with them on a deeper level, creating positive, healthy, inclusive culture, and creating space for courageous conversations and proper onboarding practices. And then promotion is celebrating companies and organizations that are doing it well. So that's kind of what we have going on. We are looking at different times that we could potentially meet, but normally we meet on a Thursday morning. I believe, Dr. Cindy, is it the second Thursday of every month? The third Thursday of every month currently. But yeah, we would love to have anybody who wants to participate in that come and join us.
All right, who's next?
I believe it's the outreach group, so I'll jump in.
Yes.
All right. Yep, I'm smiling because you guys all put a big smile on my face every day. So good morning, everybody. I'm Tim Jumper. I'm one of the 4 co-leads with the outreach group. And like I've said before, when you talk about Loop City, outreach is one of the big O's right in the middle of everything, right in the middle of all the action and excitement, right in the middle of all the good work that the task force is doing. So today we're going to be working to engage with some of our newer members in our subgroup, hopefully even add a few more. We'll be discussing some ideas on how to plan the structure of the group, We'll be talking about some of the newer tools that have been added to our tool belt to help keep us organized and effective. And finally, we'll go over a few of the initiatives that we're working on right now. One of the most exciting being the universal intake form. We're currently collaborating with a few community partners on this effort, and Kelly Blucher from Goodwill is going to be spearheading that part of the conversation, along with talking about a couple of other projects that we'll be taking on in the near future. So yeah, we're anxious to get things going this morning, and feel free to join us if you'd like.
Good morning,
All
everybody.
right.
Jeff Wolf, co-lead of the People's Group. That was a solid lead in there, Tim. I like that. So the People's Group works with basically our community members and providers and tries to improve access and services all around. And we definitely like to focus on the service providers and trying to help them kind of come up with better tools, or just giving them some just general support that maybe people don't think about as well. So in our breakout group for the People's Group, we'll be talking about the fact we need to fill a new leadership role, and that may be a membership or a strategy position. So if you're open to joining, let us know. We'll also be talking about our Speakers Bureau, and the Speakers Bureau is basically an opportunity to reintroduce the community to the community. So our first topic is going to be homelessness. We're bringing in people with lived experience and kind of giving them a tool belt for public speaking. So we help them write their story. We give them a headshot. We give them some introductions, some practice sessions, and then we are going to be trying to schedule speaking engagements for these for the speakers with different organizations from Pierce County. So we are almost ready to have our first speaker ready to go. So if you know of anybody or an organization in Pierce County that would love to have Amanda Walking Stick come and speak about her lived experiences, let us know, because we'll be doing that outreach as well. And there's a few other initiatives in there, so we'll talk about it when we get in. Thank you.
And real quick, from the leadership standpoint, before we go any further, great news. I know we were talking about blessings and wins earlier today. For you guys that do not know, Amanda Walking Stick and her husband Ben got to celebrate the birth of their newborn baby, Gloria Ann Walking Stick, who was born on Thanksgiving, or the day before Thanksgiving, 9 pounds, 12 ounces, beautiful baby girl. So we got a little baby task force member now. So definitely look out for that baby onesie coming soon on Amazon and local shops near you.
Thank you, Tamar.
Congratulations. Congratulations. Wonderful. All right. So it looks like it's time for us to do the break off. So Jeff, guide us through.
Sure thing. So I'm going to start the breakout rooms, and on the bottom, you should be able to see 3 different options for 3 different groups. And please select the one that you are already a part of or would like to be a part of, and it should take you there automatically. For those that haven't selected a group or would like to stay in the lobby and learn more, you don't have to do anything. Just stay put. If you don't see the button, just let us know, or let me know in the chat which room you'd like to go to. And then it might be like an older software issue and you just can't see the button. So here we go.
Whoop, whoop. I see the buttons. I hope everyone sees them. I should see y'all disappearing now. Everybody should be going away, going somewhere, or hanging out with me and Tamar.
Go, get out of here, go.
Go do some work.
Hit them rooms,
Should be on the bottom. So
yeah, it should say breakout rooms at the bottom of your screen. If you don't see it, hit Jeff up in the chat and let him know which room you want to go into. And we'll just assume in a little bit that if you don't go anywhere, you just want to hang out with Tamar and I and learn more about the task force. Is Deborah staying with us? Deborah, are you hanging out with us?
Yes,
yay.
That is WDC. That's WFC.
Yes, our leader, our COO, y'all. We get to hear from her this morning. Yes.
All right, let's see, Aaron.
Nick, you know you ain't staying in the lobby. You better go somewhere.
I know.
I wanted to check in with you if you had a minute, if there's some time. And I was going to join. Sorry, I had to step away and help my kids out with something, but I just wanted to ask if it would be appropriate to bring up the action from a couple of Pierce County Council members yesterday to dissolve the Tacoma Pierce County Health Board.
Are you going to be here?
I'm sorry?
Are you going to be here the rest of the meeting?
Yeah.
Before we close out, could we leave a couple minutes? That is an important thing coming up. Yes. I would love for the rest of the group to be here so they can actually hear. That is something that we all need to come together and really discuss. So right before the meeting ends, we will definitely open up the platform because they do need to be made aware of that. I just heard about it recently. So yes, you got that.
Comments in the chat. Thank you, Aaron. All right.
Roger, is there a group that you would like to go to?
Yeah, what are the different group options? Sorry, I'm unaware.
Okay, organizational structures, people's group, or outreach. Or you can stay here and learn more.
Well, which one did Erin from PNA go to? I think that was the one she wanted me to join in on.
Oh, got it. Okay, yep, she's people's group. There you go.
Perfect.
I think we have everyone. Danielle, what are you still doing in the lobby? You should be somewhere in the people's group somewhere. What you still doing in the lobby?
I'm going to bounce around and listen to everybody.
Okay.
So then next time I'm going to join another group. I'm about to make friends. You know how we do it?
I missed the description of the outreach group and the people's group. So I was hoping one of y'all could tell me a little more about it.
Oh, we definitely going to be speaking about it. So you just stay in the lobby. Okay. You stay in the lobby. We trying to find you some real estate in the next half hour.
All right. I think we have our group now. I think we have, this is a nice, beautiful, this is just wonderful. Look at all these beautiful faces and all of these great individuals, Tamar and Jeff, who wanted to join us in the lobby. The lobby is a fun place. I just want everybody to know the lobby is a fun place. But one of the things that we think is important is that if you've never attended a meeting or you've attended a couple of meetings and you still aren't sure, we've gone back into our breakout sessions, but we wanted to create a space where, one, you could hear from our leadership so that they could talk to you about why Workforce Central is doing what we're doing and why the task force exists. And then you can hear from the leader of this, which is Tamar, which I don't know where he went, but he's here. I am just the master facilitator of this group, and Jeff and Tamar, I believe, can add a lot of value of information and updates because this is their work. So I am facilitating and moving everybody around and keeping us moving forward. So I'm going to turn it over to our COO, Ms. Deborah Howell, who is going to talk to you about Workforce Central and why we're doing this work. So Deborah, the mic is yours, ma'am.
Okay, I got about 10 minutes, so I'm going to keep it less than that, of course. Obviously, I think you guys know a lot about Workforce Central, but obviously our tenet is to convene and have strategies around workforce development, and that has a lot of different structures and strategies and ways to do that. It's not just about honing in on just workforce development as the only thing that we do, but it is about the people in our community, how we develop the pipeline, the things that interrupt the pipeline, and paying attention to those gaps in terms of getting people ready to be at work. And there's just so many varieties of ways that we have to be able to flex and do that. And that's everything from removing challenges to being in training programs, to getting to work. And as you all already know, because of the great work you're doing, you know that presents itself in a variety of ways. And so we have to be really intentional, as you guys are doing, about being responsive to what our potential candidates need in our community. And that's what I like to think of, all of the potential that we have in our community. And this group has done a fantastic job of sort of finding those corners that we traditionally don't always pay attention to in our community because we've, been doing the status quo for so long, that we needed something fresh and new. And to think about, this was real simple in the beginning of the process, but the simple sentence was, we need to think about outreach differently because we are just not hitting the mark. We're going to the same places, the same faces and people, and we lack inclusion, quite frankly. And where are the champions? How are we fostering, supporting the champions that are in some of our particularly marginalized communities? So out of that was born outreach. Now, we were pretty direct with ourselves about what we thought we needed as opposed to what we normally say we should look and feel in terms of what outreach should look like or what professional services should look like, because we also serve businesses and trying to figure out really how those things aligned, how those two parts of our work should align and connect. And in those conversations and in part of those assessments, and it was a little bit of work, it was a little tough. I mean, I'm sure Tamar has sort of expressed the first thought process when we hired Tamar, the immediate response was to mold him into the social construct that we normally see. And we worked really, really hard to make sure that did not happen because we needed a champion in the community who knew the other champions who could go talk in those communities and be trusted. And we also knew that we made some missteps. And so trust in the community for some of our institutions were pretty limited. And so we spent time rebuilding relationships with a lot of partners, with a lot of our community members. And I'm sure Tamara said this too. And one of my mantras is, we say we need to do what we say we're going to do and do it the right way. So we want to make sure that if we say a service is over here, that it really is there. It's intentional, that people can access the service. And that if there's a mistake that's made, we're responsive very, very quickly, because that's really what keeps your credibility. So Workforce Central is our job primarily is to support great best practices that are in the community, but we, convene, we try to steward public dollars the best way we can. One of the promises we've made as an organization, I think, is to really be thoughtful about getting those public dollars to our community and to other service providers a little more intentionally and be a little more strategic about that and what that looks like. So those are just some of the tenets, but outreach was born of those kind of internal assessments on our work and the types of things that we're doing. And then boom, Shelley talks about, I'm just a facilitator. Well, obviously we know she's not a just to anything, and she has a high impact in doing this work. Tamar is not afraid to talk to anybody. And one of the things I was able to say to him is, it's been a very honorable pleasure to be his boss, his supervisor, to be able to say things to him like, I'm really okay with you making people uncomfortable as long as we're doing it in the right way. And it, spearheads great conversation and then great action and then great plan, which has happened. I mean, I think of the word outreach, and to me, it's super simplistic. I didn't realize outreach would become inclusion, diversity, and every other equity, anti-racism process that we've ever, that we've ever thought about as part of our thought process to ensure that everybody in our community has the ability to be touched and to gain resources that they need, and that we're asking communities about what they need, not telling them, which was very critical in the work that we are doing. So having all of these partners and you guys in this space to craft these very important messages in our communities to ensure that we are, really looking for great response from our communities and great feedback from our communities, and ensuring that voice is the first voice we hear before we decide what the thing is that we have to do. So I just will say that I'm super excited to be a part of the process, even if it's kind of invisible in the back end. I give a lot of advice, and my job, the thing on my forehead is I solve challenges. If you got a problem, bring them this way. We'll talk about them, and then we'll push you back out there for doing your thing. So I'm often not in the forefront of doing the work. I'm in the back end of doing the work, and then sometimes I'll lift. And I'm a firm component that if my staff is gonna, get in that dishwater, you have to do a lot of, pre-work, that if they need me to get there with them and stand there, I'm certainly able to do that as well. But I'm so excited to be here with you guys today. And if you're new, there's just so many ways to connect and commit to this process and find so many different alignments that is what makes this so exciting. And makes it click for many of the partners that are sitting in the room, and they get so excited about doing the work. I think it enhances their work, and it certainly enhances our work as a system and a community. So thank you.
All right, thank you. Man, look, who can't be excited every day having leadership like that? I'm telling you, I always tell people that there are two, you're working for purpose or paycheck. It's very rare that you get your paycheck and your purpose aligned. And I have to say that we are in alignment. It's very rare that you get to actually work your purpose. You get to actually do it, and like, this is what you do every day, and really excited to be able to produce good fruit every day. So this is good. And sometimes it's not always easy, or it just doesn't come together and look as pretty as we want it to look. But I have to tell you, the growth and the transformations that I've seen over the years, this is good. This is an awesome blessing to be able to be a part of the work that we do, and to be able to do it with community partners like you. Now I want to back up a little bit, because before Tamar and Jeff come in, we didn't do any introductions, which is also one of the things we wanted to do when we broke into these smaller groups. So even though I introduced Deborah, I'm going to call you out and ask you to do your quick introductions. And then once the introductions are over, I'll turn it over to the tag team, Tamar and Jeff, to take on. Debbie, we'll start with you.
I was going to ask if I could be first. I have a student who's going to be calling me. She's trying very desperately to finish her one last class, which is her internship, paralegal internship. And she's run out of VA money, and she can't get financial aid for these last 5 credits. And so I'm going to have to leave really soon. I'm an adjunct faculty at Tacoma Community College in the paralegal program and in network and cybersecurity. I have worked in nonprofit organizations most of my life, except for the brief 20-year time period at Lane Powell, major law firm in the Northwest. And I left the law firm because it was important for me to get back into an organization or work with organizations that make differences in people's lives. And so as a campfire girl, as a board member for Executive Women International, as a former board member of Tillicum American Lake Gardens Community Center, and now as faculty working with students who are in crisis, this student really desperately cannot do an in-house internship because she has a daughter who is medically frail, and so she can't risk anything going out into the community or having the community come in. So with that, I'm gonna head out, and I'll send Tamar an email about, I've got jackets and pants for that drive you were gonna do. And they're from a nephew who worked at the airport. So these are all weather, standing out on the tarmac, keeping you warm and dry kinds of coats. So I'll send you an email and you can let me know where I can drop them off. All right.
Thank you.
Nice to meet you all.
Thank you, Debbie. All right, Abigail Blue.
Good morning, everybody. And Tamar and Jeff, thank you so much for the invitation to join today. Shelley, I think you and I got to meet once when I was over at Pack Mountain, But I'm here today representing a group of investors and foundations that are working to prevent and end youth homelessness. And so I'm looking at systems alignment and how we could incorporate workforce development into options for youth 18 to 24 who are transitioning out of foster care, transitioning out of justice involvement, or just needing resources and support on the streets of Pierce County. So I'm here to listen and learn. So thank you so much for the invitation.
Thank you. Juliana Flanders.
Hi, my name is Juliana Flanders. I work for Workforce Central along with Tamar, Jeff, Shelly, and Deborah. We have a really good team, and I also work with the task force as their brand strategist.
Thank you. Miss Linda Graves.
Good morning, everyone. I'm Linda. I'm with Tacoma Pierce County Health Department, and I am the Pierce County Youth Marijuana Prevention Coordinator. I work with a lot of community providing dollars for youth to enhance their leadership skill ability and to be able to provide messages to their fellow youth around marijuana use. I just was activated yesterday for COVID response, and that's why I got the invitation to come to this meeting today.
Thank you so much. Mr. Carlos Ortiz.
Hi, good morning. Can you hear me okay?
Yes.
I'm not too presentable here, but I'll turn on my camera. Good morning, everyone. So I'm Carlos Ortiz. I'm the COVID-19 training coordinator and Latinx liaison with Tacoma Pierce County Health Department, but also own a local business here, film, television production company. So, and then do a lot of community work. So doing a lot of different things, and definitely appreciate all the work everyone here does, and just looking to see how I can add value and make create an impact with you know, the superpowers and talents that we all have. So definitely glad to be here, and I apologize for being late, but I had a meeting and I just want to jump on just to say hi and show my support.
Thank you, and your presence is very timely. You'll figure that you'll learn about that later. But thank you so much for joining us. We are really, truly, you have no idea how timely it is. Awesome. All right, thank you, sir. Aaron, yes. I'm sorry, I don't want to play favorites, but I am a little bit.
I love my girl, Shelly. Thank you so much. I'm Erin Gwinnett. I'm the executive director of Tacoma Refugee Choir. And so I like to use music as a tool to connect people. And so we're here to explore ways in which we can be a better resource. Somehow music has a way of helping people to hear messages that they might not otherwise hear. And when we're having fun, you remember things differently. You can connect with people and be seen so much more. And I am a firm believer that one of the challenges we're facing is that, especially during a quarantine, that so many people don't feel seen. And so I'm eager to be part of projects that are supporting those kind of efforts.
Thank you. And I know that we have, we've met Daniel earlier. Danielle, Joanna, do either of you want a quick introduction? And then we have you, Martin.
Good morning, everyone. You know, Shelly, I love you for saying that we don't have favorites. We don't, but hi, Carlos. I'm Danielle Thompson. Good morning. I am one of the directors of Workforce Services with Workforce Central. I oversee the Young Adult WIOA program here in Pierce. So Abigail and Linda, I'd be frightening you. And then I also oversee the Economic Security for All program here in Pierce, of where I know my friend Carlos, and I'm so excited to see that it was him. I keep seeing his name. And I do the best that I possibly can to support this amazing task force.
All right. Okay, Joanna, and then you, Martin.
Hi, everyone. I'm Joanna Rasmussen. I'm the Director of Communications at Workforce Central and also the Marketing Strategist for the task force. And I'm sorry about no video. I'm having some video issues today where won't stay connected to the internet if I have my video going, but I'm here and hello.
All right, you, Martin.
Good day, everyone. Ulysses Martin, Tacoma Pierce County Health Department, SNAP-Ed coordinator, focusing on supporting the healthy, physical, and nutritious environments that the East Tacoma community could have, should have, does have in some aspects. So it's great to see how the workforce development has been working in 98404 as a specific zip code, and I look forward here to see how I can support in any way possible changing policy systems and environmental change.
Thank you so much for joining us. Okay, so Tamara and Jeff, I'm going to turn this over to you all to do your thing, and we have about 20 minutes or so to educate people in the lobby about Deborah.
I'm just letting you know I have to leave to facilitate our other leadership team meeting, but thank you, everybody. It was very nice to meet you all.
I'll see you shortly.
All right.
All right.
Oh man, good morning, everybody. Like we said at the beginning, it's been a crazy year. It's been a hurtful year, you know. I mean, it's been a hurtful year to really just see what's been going on in the world. But you know, being able to work with you guys really allowed myself to blind from a lot of things going out, because I'm just surrounded by so many beautiful souls that keeps that energy moving and going. I actually had the pleasures of meeting Aaron yesterday for the first time. And we had seen each other back early in the year, and it was like, we got to connect, and we finally were able to connect. And it's such a blessing to be able to have her on the group as well. And it reminded me, because in her conversation, she said, I use music. I don't know how that connects. How does that fit inside the task force? You know, and when Lawrence spoke a while back, he said, you're always a connection, a connect, or committed. And I got to look at Aaron and say, you know what? You coming in, knowing what we do, and being able to support those that you surround yourself with is enough. You being here is enough. You don't have to bring something. You can take something from the table. You know, we always say it's a give and take mentality. You bringing your presence gives others the opportunity to be able to continue moving forward without the hardships, because you have the direct contacts. This task force was built, I mean, to be completely honest, out of a dream. You know, myself and Jeff, we've been around each other for 14 years now, and he's my ace. And we talked about this years ago, and we always laugh when Shelly said, you know, you get your purpose and your paycheck, you know. And so we sit like, man, we get paid to live our dream and give this community something that we've always wanted to give them. The task force comes in so many different levels. You know, a lot of people thought it was just going to be a regular coalition, and that's not what we are. You know, we're a pillar in this community. We bring purpose to this community. We want to be the voice of the community, because, you know, everyone on this phone call at some point or another has community engagement in their titles. We're all paid to do this work on some level. And as long as we're doing this work together, honestly, it takes a lot off other people's tables, to where they can give everything that they have without being drained, because it's just them doing this work. We have the opportunity to do this work together and do it efficiently and be able to hold each other accountable. You know, if Abigail needs something, guess what? She can call this task force and get the help that she needs. If Linda needs something, she can call this group and get what they need. Carlos, Ulysses, all of you guys, because of the bonds that we're building, saying that we're better than what we used to be. You know, I'm blessed to have a leadership that we do have, because, you know, Deborah was right. I remember sitting in her office, and the first thing she said was, whenever you leave a room and they're not uncomfortable, you got too comfortable. You got too comfortable in your job. And at first I'm like, hold up, what? She said, be who you are and don't change. Be that person that's going to make that conversation happen, whether it makes someone uncomfortable or not. And I think over the last year, that's really what we've seen, is we have to make people uncomfortable to have these conversations. You know, this is the work that we do. This is what we're meant to do. We have a beautiful group of people, all stars from left to right. I mean, you guys seen the screen. First time here, we got 60, 70 people on the calls, usually 80 to 90, but we had to share with another partnering organization. They had a meeting today too. But, you know, this is the work that we're doing very intentionally. You know, I look at Jeff and I, and we're sort of like Pete Carroll and John Snyder. Sorry, Dan, but we're Seahawk fans here. And, you know, we draft the best. You know, sometimes we take a 4th round pick, you know, but they become stars. And that's what we do, man. And I do it with this team, this amazing, beautiful team that I have the opportunity to work with. And Danielle, Joanna, Juliana, Shelly, Jeff, Deborah, all of you guys. I mean, you know, me and Carlos, we can talk online, we can talk offline. Ulysses, we have each other's numbers. Most of us have each other's numbers that we can call because of the respect that we have to each other and being able to have just not that I need you to do anything. Is us, we just, to leadership, we can move these mountains left and right. And so there hasn't been anything that we haven't been able to do because we build. And I always say, keep building until they tell us no. And when they tell us no, they better have a damn good reason why they told us no. Because if it's just because we don't really know, then we don't stop building. We have 3 amazing groups: People's Group, Organizational Structures Group, and Outreach Group, and they're all amazing groups. I'm gonna let my Pete Carroll jump on, and I'm gonna pivot, you know, because I don't want to have a penalty flag called on me on using up too much time. So I'm gonna take myself out the game, and I'm gonna substitute with Jeff coming into it. I don't want no unsportsmanlike conduct. You're muted. Jeff, you're muted. You're so muted. There you go.
It finally went. So I'm just gonna, we presented this, or we put together this little presentation. So I'm just gonna pull it up here real quick just to give everybody a, of course it's not working. My computer, there we go. Okay, hopefully that's working. So, yes, so I'll just give a quick overview of the 3 different groups. You kind of already met all of the leadership here, so I won't go over that. We do have a new website coming. Juliana is working hard on that, excited for that. There's gonna be a lot of standalone, or it's a standalone website, so it's gonna have a ton of new content, just videos, information, pictures. Like, let's get the word out there. Let's get the information out there so everybody knows what the heck is going on and what we're doing. So we're really excited about that. We do have a new Facebook page. So if anybody hasn't followed that, let us know. Let's see. Okay. So like Tamara was saying, there's 3 different groups. This is kind of some information from our current webpage. So we have the organizational structures, rebranding, professionalism, and interagency integration, training the staff to recognize and eliminate the negative behaviors associated with institutional racism, create direct access to leadership and decision makers in our community. They are doing a mini series or a summit, if you will, starting at the beginning of the new year. So every month for 4 months, they're going to do about a 30-minute presentation on the different aspects of DEI. So we're really excited about that. They've also worked with some local organizations like Corsmo Construction, even Workforce Central, to really kind of start that internal DEI review and evaluation, and then just giving some best practices and next steps on how to kind of progress that. Next one is outreach, and really, as you've heard a lot today, really building trust within Pierce County. Among those, we have historically underserved. Obviously, outreach is out there making connections, bridging the gaps, collecting information. You know, what do different areas in Pierce County need? What should we be focusing on for those areas? How can we get them, you know, resources and all that good stuff? So we're really excited about the work that they're really good, just kind of starting to get ready to do. And then peoples and providers, and like I was saying earlier, bridging the gap between the system providers and what the community needs. So once we kind of figure out what people need, and we need to build a program, or we need to support a program, or build a tool, come up with, you know, a database, resources, whatever that may be, that's where the peoples and providers comes in. and really kind of put our heads together and figure out how to solve that. And definitely working with organizations and the people in general of just how do we give them better access? How do we make, you know, Pierce County a better, well-rounded spot for resources and services? And that's all I have, really. It's from here, it's kind of just general Q&A. I did put a little QR code, so if anybody wants to scan that with their camera, takes 2 seconds. You can go and like our new Facebook page that was just created by Joanna about a week ago. And the idea behind that is just to give everybody an idea of what's going on without having to join a private group or any of that sort of stuff. Back to you, Tamar.
Hey, thank you, Jeff. I appreciate you always. So Marcy, what you doing here? What you doing here?
Hey, I'm trying to exit out to go deal with or listen to what's going on with the county council, and I couldn't find the button. Hi, y'all. Bye, y'all. I'm sorry. Just being human.
Bye, Marcy. No, you know, after everything being said, you know, what are some things that, you know, honestly, you guys need? You know, let that be my ask to you. You know, as your organizations, what you guys having going on, you know, how can we better support you guys as a task force? What's going to really push you to go into certain rooms and work in certain groups? You know, really, what is it that you guys are looking to do? And how do we help you do that as a unit? I know Abby has something. I'm looking at her right now. She got something to say.
You don't know me that well yet, but I always got something to say. It usually gets well, okay, so all the homeless shelters for youth and the outreach centers in Pierce County have been shut down since March. So as far as I know, and I want to be corrected if I'm wrong, but my understanding is that there's no physical place for houseless youth to connect with resources right now. And I'm concerned because I haven't heard anyone talk yet about a winter plan, and we're getting into like freezing weather, you know? And so I'm very concerned about that. And I'd love to learn what's happening, if there's any emergency response that people know about. If there are other resources or like warming shelters. And I'm gonna connect with Danielle and pick her brain raw in the next week, because I've also got I identified about $1.5 million worth of potential outreach and intervention grants, and I would love to partner with Workforce Central to, you know, get some of that money and work together to get workforce in the door in places like resource centers and shelters and transitional housing and things like that. So I'll leave it there for now. Aaron, I'd love to connect with you because I worked in refugee camps all over the world and did a lot of advocacy for refugee rights. So I'd love to know you.
See, and that's what I'm talking about. It's always somebody on here that knows somebody else that want to know another person. That's why we're here. But Abigail, to go off of what you said, I would love to connect you with a few people from the People's Group, and I think that's a group that you may want to jump to. It has you know, you have a Garrett Nyland there. He leads the Homeless Coalition for Pierce County. Amanda Walkingstick, she has lived experience, and she's actually our first speaker. And so they would know a lot of those resources as well. So that's definitely going to be the group that you're probably going to want to connect with most, because it definitely aligns with the passions that you have going on.
Awesome. Thank you, Tamar. You're
See,
fantastic.
that's how we answer questions, Jeff. We draft, baby. We draft.
Heck yeah.
And
Brother, can I share?
Yes, you can. Go ahead.
Thank you. I just wanted to share that in what our young adult program is connected, who our young adult program is connected to, is the Beacon Center. And I'm not sure what it looks like for new attendance there, but I know that they have a drop-in service, and then they also have an overnight, and they are working on their winter. We keep calling it their winterization plan, but I feel like that's a house versus a people. So
are they open though for drop-ins? They are. Okay.
Yeah. Because that's where we're getting a lot of our engagement going on right now. Like, I mean, our enrollment and engagement is insane, and we're doing a lot of source navigation through the common referral system connected to 211 there, and our case managers are there for their weekly group sessions. So I got you, girl.
I know that there's a lot going on, and this is great. This is a great exchange. I mean, like, and I love to sing, and I still haven't been able to sing with Erin. I just watch from afar. And
Kelly, I still got a spot for you, girl.
so I still have to figure out how to get that in. And maybe, you know what, I see freedom after March. That's what I see, freedom after March. So this is great. How does everyone feel? Do you feel as though, I know we'll be having the other groups join us, but before they start to kind of like come back into the main room, how does everyone feel about what they've learned today? Do you have any questions in reference to it? Is there a group that has, based off of what you heard today, that resonates with you more, that you kind of feel like you know where you sit and where you want to possibly go and do some work?
Oh, I even know, real quick, sis, for Daniel, really what Red Cross does and the things you guys are doing, outreach and engagement group would be a great spot because they plan quarterly events. That would be a good spot to possibly host blood drives while we're going in and doing those events and really wrapping everything around outside of the resources needed, but having a location where that can happen too as well. So, you know, definitely love to connect you with Tim and Kelly and their group over there. That may be the spot that you might want to start jumping into because they got a lot of great work going on. And I think when you're talking about events and hosting events, that might be a collaboration that can happen through the task force. And you're part of the task force now. So, you know, we got to hold you accountable for showing up to the games.
And one of the things I'm going to bring into this is our veteran service representatives. We have Michelle Love. I'm going to get her on this group. If you have veterans that you're serving and they haven't tapped into their benefits yet, they haven't tapped into their VA healthcare benefits, they don't know, they haven't received any assistance, they haven't been evaluated to see if they what their disability rating is. We have a very actively engaged veteran service officer for Pierce County. That is Michelle Love. I'm going to bring Michelle in because I believe that that's something that we need to know about. We serve veterans throughout all of our populations, and especially our women veterans. If they don't self-identify, I want to encourage you to encourage them to self-identify and to make sure that they know who to connect to. We have a Pierce County Veteran Service Officer, and there's a whole other group that can help them as well. There's resources available to them that are with communities that they're familiar with. Sometimes it's just about knowing that somebody else either knows or has lived your story. So there are a lot of great organizations here that I'm going to be bringing in from the veteran community. That's their whole focus and service and who they serve. So that way, if you have veterans in your participant pools, you can actually connect with these other resources to help them get the benefits that they deserve and some resources that they are that they need. So, and we also, if you don't know, we have some we have an organization that has veteran homes, that houses homeless veterans specifically. They may be able to help if they have a room or bed available. So I'll just try to get those individuals, those organizations to be a part of this task force. From that spectrum, I lead our military initiatives in Pierce County, our workforce military initiatives. So I'm gonna do my due diligence to get them to this conversation as well, so that they can educate and inform the community on the services that they provide to our veterans, and that way we're not leaving things out, money on the table, as I say, benefits, disability benefits not being, you know, gone after or not knowing, you know, how to get those resources. So it looks like we have other, coming back. Everybody's coming back into the lobby. This is great. I hope everybody had a good time. Give me an emoji, give me something, give me a heart, something if you feel like your time and your outbreak, your outreach, your breakout rooms were productive. If you shared, if you met, if you connected, let me know, let us know. Yes, I am feeding off of all of this energy. Hey, Courtney. I'm so proud of you. So yes, keep giving it to us. Yes, yes. So it looks like everyone's coming in. Thank you so much. I'm looking at your beautiful faces. Share the love. Okay, all right. So Tamar, we had do we have
Nick's here. He's here.
Okay. All right. So there was a request. So go ahead and take it, Tamar.
So I don't know if many of you guys know, over the last 24 hours, a few things have happened in the Pierce County Council that most of the community wouldn't know about because, you know, keeping things under the rug. But we're thankful to have Nick Bayer here with us, who actually knows about the situation, and he's going to come show some love and make sure that as a group we are all in the know of what's going on and how do we assist in this to make sure that that does not happen. So Nick, you got the floor.
Thanks, Tamar. So yesterday, without any notice to the city or to a number of members on the Pierce County Council, Council members Roach and Richardson brought forward a proposal to dissolve the partnership between Tacoma and Pierce County in the operation of the Tacoma Pierce County Health Department, and to replace it with a Pierce County Health Department in which the director would report directly to the county executive only. And that change would mean that no longer would there be a Tacoma Pierce County Health Board. That board currently consists of members of the Tacoma City Council, some of the Pierce County Council members, and a few other medical professionals. So it represents a pretty shocking, fast, and non-transparent proposal to consolidate power under one individual who frankly doesn't have a great track record with equity. There's a proposal to discuss that next week at the December 7th council meeting. I'm going to get a little bit more information later this morning, and I'll try to share that out with this group about how you can get involved and voice your opinion. But you know, the one quick and easy thing to do is call the county council members, email them, and then show up at the meeting. There's probably going to be a digital way to do that, and I can share more information about that. But it came as a big surprise to folks at the city and to members of the county council. And so I wanted to bring it to this group and make sure that folks were in the loop and could have their voices heard.
Perfect. Thank you, Nick, so much. You know, for you guys that are on the call for a few times, we know that the Tacoma Pierce County Health Department is a big partner to us. Another one of their groups is the Equity Action Network. They partner with us and they do a lot of great things with us. We have a lot of their representatives online right now. And I just want to make sure that we can support them as much as we can. Again, personally, this is a problem. You know, they've really taken a stand on equitable services in Pierce County, especially during COVID, and making sure that we're supporting the community in the equitable ways that we need it to be. And this is just another showing of why our voices need to be heard, and we need to stand up and stop placing people in positions just because we feel that they just need to be there. They need to earn their positions. And this is just a way of showing that. You know, we need to start standing up, and next week, if our voice can be heard and we can support the health department and their staff, and especially our colleagues that are part of that unit, then we need to speak up and let that be known, because this is horrible and it's not going to be a good effect to the communities that we serve and we work to serve all the time. So please, Nick, if you can sit and get that information to us, I definitely want to support that. I hope you guys all do as well. And yeah, we'll get more information about that. You up, Shelley?
It looks like Jeff was about to say something.
Oh, go ahead, Jeff.
I was just going to start closing it out. I'm just excited for where this group has come this year. I'm just excited. I'm excited for where we're going. I'm excited for all the different things we're putting into place. We're growing, and it's exciting. And thanks for being here.
All right. So let's just say this. We can end this on a great note of one, gratitude. Thank you all for everything that you've done. For those of you who have joined and you saw the value, you saw the vision, and you just jumped on board. And we hope that we have been able to not only feed your soul, but give you the energy you need to keep feeding and planting in others. Remember, as those who serve, those who give, we also have to be fed as well. You can't minister to anyone on an empty tank. You can't do the work that you do on an empty tank. This is the place where you get to come every month and be filled, refreshed, reset, and so watered. And so I want to leave the spirit and thought of cultivation. I want you to think about what cultivation looks like. I want you to think about what it feels like to till the soil, to renew, to refresh, so that when fresh planting is able to start, you are ready to go. That means your soil is enriched and you are invested. And so by doing that, as we close out this year, as we close it out, no, it's not been pretty, but I tell you what, if you have not used this time to transform your mind, to transform your soul, you have wasted a lot of time. And I believe that everyone on here has found their own unique way to transform their thinking, to transform their mind, and to do something different. This has also been an opportunity for you to actually work, to not be a hobbyist, but to be someone who is actually going from making your hobby your business. If you started your side hustle, we want to celebrate you. If you've been able to start a new gig, we want to celebrate you. If losing your job allowed you to actually start doing something you should have been doing a long time ago, we want to celebrate you, because what that means is that you are still growing and investing in yourself, and you are also an investment in the community. We want you to love on yourself and love on one another. If there is someone you have not spoken to for whatever reason, I want you to release that anger. I want you to let it go, and I want you to love on them. Forgiveness, that's for you. That's for your soul. That's for your mind. That's for your heart. We will not say that 2021 will be much different than 2020, but what we can do is say that we're going into 2021 with a renewed mind, renewed spirit, and a renewed purpose to continue our work. Don't waste time. Live life well. Embrace somebody virtually if you have to. Do something that you've been scared to do for a very long time. I can't tell you. Fear can either paralyze you or it can move you forward. We want it to move you forward. We want you to cultivate. We want you to plant good seed in good soil. And we want you to get into the grit, which requires work. So you keep doing that work there and bring that work back here so that we could collaborate and do great work here. Much love for all of you in the new year, and we wish you well. So thank you so much. This ends our last meeting for 2020. Love you all.